5, I'd like to call the Health Committee meeting to order. Apologize for being late. Can I get a motion to approve previous meeting minutes? Motion by Gary. Second by Mr. Grimm. Favor? Number 1, authorizing an agreement with the Albany Medical Center Hospital regarding morgue and laboratory services.
2, 3, 4.
Is there a quorum?
I understand, Tim, we're going to do a 2-year agreement only with Albany Med.
2-year agreement with Albany Med, and I'm looking for the committee to act on both the proposals that were submitted, the Ellis also.
And, well, you're talking about number 2, that's going to be a 6-month?
6 months agreement.
Trial
Trial period?
Trial period, yes, and I'll report back to the committee in 6 months, let them know how it's working.
Okay, thanks, Tim. Any questions from the committee on number 1?
I'd move it.
Motion by Gary.
I just asked, we've talked about this idea that we as the host county are responsible for the morgue services, and the controller has issued an opinion that we are responsible. But have we ever investigated as to what the actual legal ruling is? Has there ever been a legal ruling on this? Because it's, we're actually getting hit with the bill.
That's correct.
Does anyone know, I guess my question is, does anyone know beyond the controller's opinion, if there's been any law on this?
Well, I understand it's in the county charter as far as a legal opinion from the county attorney.
Yeah. I mean, I've actually asked him for one too, but I wonder if anyone else was aware of any legal ruling that required us to pay for these services.
I don't recall if the attorney had ever ruled on that. We could look into it.
Okay.
So, Mike?
So you want me to, you were requesting a formal opinion from the county attorney as to why the county is responsible for out-of-county individuals, correct?
Is that what you're talking about?
Yeah.
It's state law. It's been law.
The paperwork, it doesn't say that. It says it's an opinion from the controller's office.
When you say controller, do you mean the state or the?
There was something in the background.
Yeah, yeah.
Could you just give us the state law? That's all.
Thanks, Mike. Okay, we have a motion from Gary. Do we have a second? We have a second. Mr. Grimm? All in favor? Any opposed? Thanks. Number 2, authorizing an agreement with Ellis Hospital regarding morgue and laboratory services. And Tim, as you mentioned, this is just a 6-month trial period.
It's a trial period. We need to do, the doctor that works out at Ellis is what we really need. He can only do his work at Ellis. He will be on our rotation 1 week a month. So we're talking 6 weeks into 6 months, just to see how it's going to work. We're not the only county that does this. Schenectady County uses Ellis also, but in certain cases, they send to Albany Med. Same thing with Saratoga County. They got Saratoga Hospital. They'll do a lot of their cases there. Certain cases, they'll ship down to be done at Albany Med.
Yeah.
Same thing at Rensselaer County.
And I don't recall the answer, but what was, I know we've asked this before, but St. Peter's, Memorial, they don't provide?
They don't provide the service. They do have morgues in these places. They're not staffed. They do not have staff there. They're not big enough to do it. That's why they've never been on any of the work.
Thanks, Tim. Any questions from the committee? Number 2, have a motion to move. Motion by Brian, second by Jerry. All in favor? Any opposed? Okay, moving on to current business. Number 3, local law, number S for 2016, local law of the County of Albany, New York, regulating the use of polystyrene foam, disposable food serviceware, and requiring the use of biodegradable or combustible food serviceware by food service establishments in Albany County by amending local law A for 2012 as adopted, November 12, 2013. Sponsor is Chris, right?
Yeah, sure, Doug and myself. So, several years ago, Doug and myself, with the support of the body, managed to get the local law passed that prohibited the use of styrofoam by chain restaurants. At the time, the county executive held a number of hearings on it. He ultimately signed it, and I believe he had said at the time that the goal would be to expand this after several years so that it applied to all restaurants, so it's not merely, what's good for Dunkin' Donuts should be good for the other small businesses as well. And the idea was at the time we restricted it to chain restaurants because they could easily absorb the costs associated with transforming over to biodegradable materials. So it's been in effect for several years. So what we've done is Doug and I have updated that local law to amend the definitions so that the local law will be applicable to all food service establishments in the county. And that's basically all it does, nothing else. This is the 2013 version of the law, and all we did was bracket out and amend the definition. And that's what it is. It's an expansion of what we did in 2013. It's 3 years later. I think that these other businesses have had adequate time. As many people know from the city, we have a tremendous issue with our landfill in the city of Albany. It's rapidly filling up. It's no longer being used as the revenue source it once was. Eventually, it's going to have to close. And I think our body has been very progressive in our positions on environmental issues. And I think this is just the next logical step on this topic. So that's it. There is no public hearing resolution. I forgot to introduce it, so I sent it in.
It will be on this
It'll be-
month.
Yeah, it'll be on the,
It'll be on the October 13th.
it'll be on the October, so there will be a public hearing, that'll come back to the committee in October. So I would ask, I guess, in the intro, if it's okay with Doug, if we could send this to, to the
You table this.
Board of Health. Board of Health to get their opinion. We did that with the last one, so I think it's logical. They sent us a letter in support after they voted on it. So I'd like to have them review it if that's possible and table it at the committee level, pending the fact that I forgot to put the public hearing resolution in as well.
I'll send a letter to the board.
Sure.
Okay. Question, Brian?
No, just totally agree with everything you said. One quick comment in terms of the Board of Health, just to keep in mind, the Board of Health's opinion is advisory and does not bind this committee or the legislature. And
Yeah.
sometimes that's been a little confused, and I want it to be clear, the County Board of Health does not have a veto power over any legislation we propose to them. We simply look to them for advice and guidance.
I would also put a plug in that we are actively looking for co-sponsors, so if anybody is interested in jumping on this with us, please let Pat, Brendan know in the council's office.
Put everybody on, why not? Who could be against?
Well, I don't know if everybody's supports it.
Who's against?
You'd be surprised.
Yeah.
Well, put me on, put me on.
All right.
Right, I just have a question for Mr. Higgins. I supported the last bill that we had, and during that whole process, there was concerns from some of the non-for-profits, like, for instance, Meals on Wheels and Congregate Dining in Albany County, for the cost of, the additional cost of this type of to-go materials. And I don't know if it's something we can carve out for a nonprofit like them to be exempt from this law, but I'm just putting it out there and see what they say when they come back. But I know it was substantial for Meals on Wheels, the cost of this. And we fund Meals on Wheels, so I don't know if we're just robbing Peter to pay Paul, and, other than that, I wouldn't have any problem with it at all.
Yeah, I don't think Doug or
You're the only
I,
ones I'm thinking
We
of.
can exclude them.
Yeah, yeah.
And the most important part is to include the governmental, because the governmental is the biggest part in Albany County, especially given all the state buildings that we have and all the cafeterias from the state buildings. So, I think, excluding something like Meals on Wheels is generous and it should be done.
Thank you.
Mark?
Yeah, my question would be, why would we exclude them and other small businesses that are struggling every day? Don't they matter? So if we're going to make exclusions, I think that should be a long list. I do have some questions for the sponsor, if I might. What do you propose to replace these styrofoam cups with?
well, so we went through this a couple of years ago, Mark, they came down, there's a business, I think in Essex County, they came down and made a big stink about it, and they're gonna lay people off. At the end of the day, they just started using a similar product that is recyclable. So if you look at a Dunkin' Donuts cup that you purchase in Albany County now, if you look at the bottom, it's recyclable and it's made with a different material.
How much more is that?
I don't know if the
It's
price of a cup of coffee, I don't
incrementally
think
more. I
it.
did a survey with the Albany County Health Department, and they did a price comparison between paper cups and the styrofoam, and the paper cups were incrementally higher than the styrofoam, and it really wasn't that much of an added expense. And so I think, even the nursing home would allow for it, especially now that they've gone to all,
I don't
But because I remember reading about this, as I recall, paper cups were being substituted, and paper cups have an issue in terms of disposability. Is that correct?
No, they're biodegradable.
All the paper cups
That's
are?
all we're calling for, biodegradable.
Is that wax covered or non-wax covered?
Well,
Because of wax
they're biodegradable waxes.
And how long does it take for those to biodegrade?
I don't think it makes a difference because styrofoam doesn't. That's the problem.
Right, but with all due respect, the sponsorship says that, the landfill's filling, which is true, and that this will save space in the landfill, but is there some sort of reasonable time frame that you could expect a paper cup to biodegrade versus
You can Google it.
a compostable item or something like that? I mean, in other words, what I'm saying is, has anyone looked to see what the efficacy of this law was?
We did back then.
And I mean, since the 3 years, in other words, how much landfill space have we saved? Has there been any sort of, does the landfill space reclaim as
It's
the
not, not just landfill, it's plugging up these sewer systems that these styrofoam cups do. And it is a big problem throughout the entire sewer system of Albany County.
Was there any comparison made then between attempting to use paper that biodegrades and actually just using something recyclable? Because I think Mr. Higgins mentioned recyclable, then somebody mentioned biodegradable. So those would be two different programs. My question here is,
Both are applicable.
right, my question here is, couldn't we be looking to amend this law to include recycling initiatives rather than simply specifying a product?
Yeah, the problem is polystyrene is not recyclable,
Right.
so nobody will accept it.
Not here, but that's
Not
because
the county
we don't have that program.
Not this
set up.
side of the
Not
Mississippi,
the city.
anywhere.
Maybe pros come in and they can.
That was the
they can
issue.
sell it.
Ernest is correct,
Chris,
wax paper.
just one thing. It is recyclable. It is not recyclable currently in Albany County.
Correct.
This side of the Mississippi.
I'm not sure that that's true. I think in New
I
York City,
read.
I believe in New York
San
City, this
Francisco
law
does
was
it.
just,
That's it.
a similar law was just knocked down by a judge because there was an availability of recycling. So, and I don't want to get into semantics about that,
That's
but
not availability, that's all.
I guess what I'm saying is if our goal is to reduce the usage in the landfill and reduce the stuff that's gonna hang around forever, wouldn't the fastest track to that be recycling?
Well, I don't disagree with that. It's the problem.
Because that immediately reduces
Yeah.
landfill space as opposed to waiting for it to shrink.
Problem
and
is
then
we
just
don't have
get new space.
technology here to do that. I remember they did come in, those organizations came in and talked about that, but then, we quickly found out they couldn't recycle. That technology is not available.
I'm also for waiting for it to shrink. I think that's important,
Brian, did you have a
because
question?
styrofoam doesn't shrink.
Just a comment, I think Chris is right in terms of recycling options back when we looked at this. My sense was there might be a few more viable recycling possibilities now. I don't think it would hurt to kind of take a look into those and see if they are viable.
Well,
And my sense was it's gotten a little bit more advanced since we looked at this a few years ago.
Yeah.
Mr. Chairman, I have a few more questions
Oh.
if I would. So has anybody, I sort of touched on it, anybody sort of tested the efficacy? In other words, has anyone gone out and inspected to see if everyone's complying?
So, yeah.
We got
so-
90%.
So the county,
90%.
yeah, the county doesn't, in fact, check for this.
Who's doing the inspections?
The health department.
Health
Health
department.
department.
Yeah, when the health
Is there a cost associated with the inspection?
I don't know, I mean.
No, it's routine, and they
You
go
know,
out
So it's
there
just during the
anyway.
normal health
Yeah,
department?
normal
cleanliness and
inspection
stuff like that.
cycle.
They don't-
Well,
That's what I'm
the health department does restaurants.
Right, during the restaurant.
All the
We have a health
folks that go
department
in the
opinion here.
stores is Aggie Markets. They don't inspect them.
Right, there's a separation there.
My recollection was that health department told us there wouldn't be any additional budget costs
Well, let's
to
hear from the
enforce
health
because it could be done
department.
within current
Within
staff.
the current.
Well, that's the goal, so we'll send it down to them, and we'll go down and talk to them, and hopefully they pick up.
Speak up, please.
Okay, do you want, okay.
What, because I noticed in.
Hi. Okay, I'm Marcia Lenahan, and the Director of Environmental Health. Yeah, we did assume this into our regular duties. There is an extra cost in that. It takes extra time to do it. The compliance record with the restaurant, the chain restaurants, was very high, actually. We had only 2 legal actions in 3 years of places that didn't comply, and they were settled by fine. So this is appreciable more inspection, more time, because it's every single restaurant too. And the other concern is, does this include Ag and Markets? The way it's written, it could be interpreted to include ag markets facilities, and that's another whole, we do not even go into those
We
places.
can't tell Ag and Markets what to do.
Right, we don't go into those places, but
Right.
you need to clarify how it's written so that ag and markets isn't included as a food service. Like Price Chopper has food service in it,
Right.
so that just needs to be clarified because we don't inspect those
That's
places.
very clear, that's Ag and Markets.
It's,
It would be unenforceable in that case,
Yeah.
by the county.
Yes, it is.
So,
As it applies to those businesses.
would you consider writing this legislation to include, here it says, alternative is biodegradable or compostable, but could it in fact say recyclable? Would that be an alternative for a vendor?
Fine.
Okay, we could add that to your legislation and say, hey, you got the choice, recycling, which is probably the number one way to save space, right?
Yeah.
You can do that, or you can do these other two things. All we want you to do is avoid the styrofoam. So, there might be a way to make this a little more inclusive and a little less cumbersome, and maybe provide a little bit more environmental gain.
I didn't even, we're gonna send it down to them, and we'll go down and meet with the health department to see if they have any input on it, and, go from there.
Brian, did you have a question?
Actually, yes. How much more did you have to request in your budget to enforce this?
I don't know that I don't know that answer.
I don't believe we asked for any more. I think we just
Okay.
absorbed it within.
I used the inspectors that I had.
Right.
Okay, thanks.
I'm not so sure about this one.
What about the idea of wax on paper cups, not making it
You know,
recyclable?
I don't believe it affects it, but I'm pretty sure it doesn't affect it.
Chris, you were going to speak to that earlier.
And I don't know.
We define what polystyrene foam is in the bill, and that's a separate issue. Those are separate products.
My understanding, Chris is going to table this now until we get the schedule for the public hearing. Just so we don't have any confusion next month, is there any last questions for Chris?
I
Gary?
just wanted to say something that Mr. Grimm said, that on the small business owners, I do a lot of takeout, and every one of them do a surcharge on it. So it's not like the small business guy is getting hit for this extra money. And some of them I think are substantial, because I know the cost of what these items are. And that's fine too, because I choose to get it to go. But don't think that it's going to be a financial impact, because it's not.
Thanks, Gary. So this is, Chris, table on motion on the.
Yeah, we'll table for now, and send it down to the Board of Health so they can take a look at it, and I'll attend their next meeting, or Doug, or both of us discuss it with them. They did issue a letter when we did this the first time, so hopefully, after discussing with them, we can get another positive opinion to the board.
Chris?
Can you add Gary and Burton?
Sure.
Gary and Mert, yeah.
Number 4, authorizing the submission of a grant application regarding a New York State Department of Health Research Incorporated linking interventions for total population health, lift population health grants. Commissioner Whalen?
Hi.
Not Commissioner Whalen. Sorry.
Commissioner Whalen was called away, so I'm here to cover Mary Beth Miller, the Assistant Commissioner of Health. Good evening. We respectfully request approval to apply and accept funds, if awarded, for a New York State Department of Health grant called LIFT, Linking Interventions for Total Population Health. The grant focuses on reducing obesity and diabetes, and we'd be using numerous strategies, basically clinical and community-based strategies to address this issue. It is a 27-month grant for a total of $750,000. There will be only 2 counties or entities awarded within the state, and so it is highly competitive, but we believe we have a good proposal to submit. The proposal is due September 30th, this Friday, and so we request your approval to move forward.
Brian?
I would really ask that efforts be made to get these requests into the committee and to the whole legislature before the due date. I mean, obviously, this is not going to be approved by the legislature before you put your application in. But the RFA went out August 5th, so this really could have been considered in our August meeting and acted on by the full legislature in September. Just a bit of a pet peeve. I would prefer that these requests come in timely so the legislature can act on them so that you guys aren't putting applications in before they've been formally approved.
Sure, we'll certainly do our best. Sometimes it takes a little for us to get them and get the approval to send in a letter of intent, et cetera, but absolutely understand. We'll do our best to do so. Thank you.
Gary?
I agree with Brian, because I'd like to see your proposal. that you're submitting for the grant, you know. I mean, we had a grant here a couple of months ago, which I approved. I didn't like the way it was written, because I didn't think we were competitive enough for a grant on obesity. I think it was like obesity too.
Yes.
And we were just supporting the rail trail with the money.
For the obesity.
Any other questions on number 4? Can I get a motion to move? Motion by Gary, second by Brian. All in favor?
Aye.
Any opposed? Thanks, thank you.
Thanks.
Actually, well, we got you. Number 5, amending resolution number 231 for 2015 regarding an agreement with Health Research Incorporated for an Ebola and other infectious diseases preparedness and response grant.
Thank you. We request the approval to extend our Ebola grant contract. It's from HRI, and we're asking to extend from September 30th, 2016 to December 31st, 2016. This grant provided support to address the Ebola issue back in 2015, specifically Ebola preparedness and response issues. New York State Department of Health expanded the scope of the grant to allow us to use it for other emerging infections, and so this allows us additional time to do so.
Can you use this for Zika?
Yes.
Any questions from the committee?
Yeah. Where are we today on Ebola, both the county and the state?
Ebola
Yeah.
specifically. I would have to, I don't want to speak off the top of my head. I think it would be best to provide you, if I could, with an update from our epidemiologist. There are no cases of Ebola, and I believe the outbreak has been resolved in Africa, but I would feel more comfortable providing that information.
So there's none in Albany County, but
Ebola, no.
there might be some in New York State, you know?
No, are you talking Zika or Ebola? I'm
Oh,
sorry. Zika.
Zika, yeah.
Okay, oh, yeah, so Zika, there are no currently existing Zika infections that were acquired in Albany County or the United States, with the exception of those in Florida. And we continue to monitor. There's been none in New York State, with the exception of those that have been acquired outside of our country and sexually transmitted.
So they've been able to kind of contain it in Florida then, as
At
far
the-
as we know?
As far as we know at this
Okay.
point.
So Mark, do you want the
Any other-
Ebola figures, or are you all?
No.
You meant
okay.
Zika?
Yeah,
Okay.
yeah.
No problem.
Any other questions from the committee? Can I get a motion to move? By Brian? Oh,
I'll make the motion, though, with the same comment about timeliness in the future.
understood. Question, is that a motion too?
Yes, yes.
Motion, and second by Gary, all in favor? Any opposed? Thank you.
Thank you so much.
Thanks. Number 6, looks like Dr. Giordano. Good evening.
Good evening, Mr. Chairman.
Authorizing the submission of grant application with the New York State Division of Criminal Justice Services regarding the Reentry Task Force Program.
Yes, so earlier this year, I came before this body to request permission to apply for an extension. This grant expired July 31st. The New York State Division of Criminal Justice Services wanted to align the 19 reentry grants across the state on the same schedule, and what this resulted in was your approval to extend this contract from 7/1 of this year to 9/30, and I'm coming to you today to ask for permission to request the extension for the next 3-year renewal of this contract. Department of Mental Health has held this contract since 2010. Previously, Department of Social Services was implementing it, and we've discussed this just recently, but it is a successful program. We touched over 240 lives in our last year. These are folks who are coming out of state prison, reentering the community, and assessed to be at relatively high risk for recidivism. The new grant affords us some new options to expand and to perhaps touch over 300 lives. So this is, with respect to the comment earlier about timeliness, I can only say that the announcement to apply for this and the letter of submission and intent did not allow us, before the RLAs were due, to give this to you last month. So we had a 2-week window to apply, and we've done that. but the point was well taken, made by the legislator.
Any questions for Dr. Giordano?
So are you saying it's this, the state puts you in a box a lot of times because they don't grant?
Well, in this case, by way of explanation, not excuse, they give you a short window, and these are in some ways.
It would be helpful if they had an earlier window.
Yeah. Well, and this was kind of a formality because the 19 counties that have had the grants, they're expecting to give us another 3 years, but we have to go through the motion. And they're not very respective of the local process.
Well, we appreciate your working so quickly on it.
Thank you.
Dr. Giordano, this is just a
Yes, sir.
question about the letter itself, whether, are we applying for is this the agreement or the application?
This is just a request to apply for this new funding.
Any other questions from the committee? Need a motion to move? By Gary, second by Brian, all in favor?
Aye.
Any opposed? Thanks. Number 7, amending resolution number 281 for 2016 regarding additional funding for the Addictions Care Center of Albany, amending the 2016 Mental Health Department budget.
Correct. So the governor has issued a number of opiate and heroin initiatives. One of them was to afford localities the opportunity to develop what they're calling family navigator programs. One of the benefits for being close to the state office is that they came to Albany County first, and they gave us this opportunity before they made it statewide. We did an RFP, followed the local procurement process. We had one responder. It was the Addiction Care Center of Albany. One of the requirements for the successful proposer was to have an intimate knowledge of the local drug and alcohol addiction system. They met that criteria. They are one of our longstanding trusted partners in this effort to treat addiction and alcoholism. We felt that despite the fact that we only had one responder, they met the criteria and exceeded it. So we're coming here to request an amendment to their budget, to their contract in our budget for the amount of $100,000 to hire a family support navigator.
Thanks. Any, Mr. Drury?
I do have a question, and it's more a point of interest.
Sure.
What population specifically does Addictions Care Center of Albany serve? And by that I mean, do they have a set of their own clientele?
Oh, yeah.
Or is this Albany County at large that they are open to? In other words, who will benefit?
Well, they serve Albany County residents, and they are open to people with a range of addictive disorders.
I guess what I mean is, I know a lot of the organizations that work with this at-risk population
Yes.
has sort of a group already that they're working
Yeah.
with. Is this to serve, in other words,
I understand.
is it open to?
Right, so for this particular position, and again, this came from a state initiative, there was a recognition in this environment of what many are calling, I think accurately, an epidemic. Family members are lost. My office gets calls all the time. People don't know how to access treatment. They don't understand insurance. They don't understand addiction. And what this is an attempt to do is for all newcomers a place to go that would help them navigate that system, so it's increasing education, access to care and support, and for all comers.
And your department can refer to them then?
Oh, we will, because we get these calls all the time, as I'm sure others in this room do. And
Well, and I can see the need for it, so I'm in no way suggesting that it's not
Understood.
appropriate. The other question I had was on cost of staff. Is the $100,000 line of, is that essentially going to the agency, or is that literally the cost of the staff and associated
right, so
payroll?
the RFP that we distributed had a scope of practice and the request for a budget. And the budget that they submitted for the $100,000 is salary and fringe for an individual. It's for equipment, it's for travel, it's supplies, it's for media campaigns. It's a fairly well articulated,
The additional overhead for their...
yes,
their,
to meet the
organization.
goals of this project.
Okay, well, thank you for clarifying.
My pleasure.
Any other questions from the committee? Dr. Giordano, we've spoken on this, I've heard at-risk groups, and it seems to be this heroin epidemic is affecting all families in Albany County. I mean, there's no specific at-risk group anymore with heroin, is that correct?
It's an equal opportunity employer.
Yeah. So I think everybody from Albany County could benefit from that. So can I get a motion to approve? Brian, second? Gary, Mr. Grimm, all in favor? Aye. Any opposed? Thanks.
Thank you very much.
What happens to the authorization to grant Gilbane?
Only that we might get more state funding.
Probably won't know.
We could.